Hi there, Dr. Scott Martin here. You're probably feeling like a bit of a PCOS expert by now after delving in depth on the topic. Now let's push that a little further and hear what you are and are unlikely to hear from your doctor or gynecologist. So what you're likely to hear from your medical doctors about PCOS is, we can't fix it, but we do have medicines that can treat the symptoms. These include the contraceptive pill that will make your cycles regular. This is for women who do not want to get pregnant but want the PCOS symptoms managed. The contraceptive pill does not treat PCOS, however, it may regulate your menstruation. Your PCOS may naturally resolve over time, especially if diet and weight loss have been attended to. However, if not, your PCOS will likely be waiting for you when you come off it. Clomid, otherwise known as clomiphene, can make your body ovulate. It works by blocking estrogen receptors in the hypothalamus and, in turn, makes the pituitary gland release follicular-stimulating hormone and luteinizing hormone, which create ovulation. This can also make your cycles regular and is the first line of pharmaceutical therapy for this disorder. Clomid has been known to be quite successful. However, it commonly causes heightened stress and anxiety with each cycle. 4 to 6 cycles are about as much as most women can handle before wanting another therapy. Clomid is the most common treatment for infertility in women with PCOS trying to get pregnant. It has a 20% chance of pregnancy per cycle, according to some sources. It's worthwhile knowing that women treated with Clomid are 10% more likely to have twins or triplets than women who get pregnant naturally. It's also important to note that Clomid does not treat the cysts that prevent natural ovulation. Next, we have Metformin. It's proven to assist in ovulation, but has not been shown to increase pregnancy rates. Metformin's function is to treat people with insulin-resistant diabetes, but was discovered to have an effect on promoting ovulation in women with insulin resistance. Often, metformin is combined with Clomid, or sometimes just used alone. It's typically used when Clomid has not been able to create ovulation. It's scientifically unknown how metformin actually works on ovulation, but it is proven to assist in ovulation. If you have PCOS and are insulin resistant, you will most likely be put on metformin either way. Number 3, letrozole or Femara. This is a drug that's been used to treat breast cancer as it slows estrogen production. And as a side effect of this, the body produces more follicular-stimulating hormone, which is needed for ovulation. Letrozole is as effective as Clomid in causing ovulation, but much like metformin, has not shown if it improves pregnancy rates. Safety trials are underway as tests on pregnant animals have shown it to create birth defects. It should be noted that women who are taking letrozole who do fall pregnant stop taking the drug immediately, which reduces the risk of birth defects. So they're the first line of defense in treating women with PCOS who want to ovulate. When these first line of drugs fail, gonadotrophin injections containing FSH and LH can be given to create ovulation. These injections provide extra hormones that the pituitary gland may not be excreting to cause ovulation. This treatment is costly and has a higher risk of multiple pregnancies than using Clomid. Your doctor may need to use frequent laboratory tests and ultrasound exams to watch how your body responds to this treatment. Now, if none of the above therapies work, surgery is the final line of treatment. This is a laparoscopic surgery, also known as laparoscopic ovarian diathermy, or drilling. And this is where the surgeon makes a small cut in your abdomen and inserts a long, thin tool called a laparoscope. The surgeon then uses a needle with an electric current to puncture and destroy a small part of the ovary to release the eggs. The releasing of trapped eggs can reboot the natural hormone cycles that create ovulation. This procedure can be very effective, but is also known to leave scar tissue on the ovary and can, in some cases, cause irreparable damage to the ovary. The risk of adhesions from surgery has seen this technique revolutionized over the last 40 years to decrease the incidence of adhesions, but current rates are still around 19%. Surgeons attempt to cause as little damage to the ovaries as possible, but complications and the risk of adhesions still make this procedure risky. This technique is only considered if lifestyle changes and previous medications have been used without success. This surgery may be less costly than treatment with gonadotropins, and it does not seem to increase the risk of multiple pregnancies. Those studies have shown the success of this surgical intervention effective at releasing trapped eggs from the ovaries that will ultimately reboot the normal cycle of egg production and restore hormonal balance. It does carry the risk of irreparably damaging the ovaries and is actually no longer recommended by all professional medical societies as a treatment option. So there you have, in full, everything you need to know about PCOS and how it's treated. I hope you found these videos helpful. And please remember, there are safe, natural and effective options out there that are not offered to you by your medical doctors or gynecologists, and we have those for offer at the Advanced Fertility Solutions website. I'm Dr. Scott Martin, and thanks very much for watching. Have a great day.